Well, networks developed out of the cancer plan in 2000, which recognised that cancer care wasn't as good in England. I think, to be fair, many doctors, I think, were surprised that the outcomes weren't as good as they thought. And there was an appreciation that waiting times were long, that care was not well coordinated, and that patients weren't getting as good a deal as they should have been. And the cancer plan came, I think, tied with investment was tied to change in practice. And I think certainly for the first few years what was exciting was there was a lot of new cash, but the condition for the new investment in cancer care was that practice would change. I think quite quickly over the first 5 or 6 years we saw quite a lot of changes. Change in practice changed the way in which doctors work, and the investment, I think, saw reaped a great dividend in changing practice and improving outcomes. What patients immediately saw was a reduction in waiting times. That I think the biggest change was a much greater, a better coordination of care. So patients had their tests done in a more coordinated way, that medical teams were better coordinated between themselves. And so I think the first thing patients would really see was that they got treated more quickly, and for cancer that's important. I think for the doctors and nurses looking after patients, what they saw was what I think we'd seen in breast cancer care for a long time before, which is that working in teams was actually good for doctors and nurses. It meant that care was firstly coordinated but also consistent. And I think frequently before that, some clinicians preferred working on their own, and there are always compromises to be made. Working with a group, you lose some personal autonomy, but overall I think there have been significant gains. The network contains an awful lot of skills, so my job as a senior doctor is to pull together the other senior clinicians who work in cancer, and I think we've been really good at getting people to work together. So going forward, I think the emphasis is now going to be more on measuring outcomes, less on process. I think process has always been a somewhat artificial tool. It doesn't necessarily tell you about outcomes, but you can use it as a proxy for outcomes. Knowing exactly how institutions and organisations have fared in terms of outcomes is important. So I think going forward I'll be keen to make sure that we can measure exactly the type of patients being treated, when they're treated, the stage of their condition that they have, and the types of treatments that they have received, in order that we can show that institutions are improving patient care. So that's one aspect. I think a second important aspect will continue to be the pressure on improving efficiency, the so-called QIP agenda. And the network has an important role to play in both working with clinicians and clinical teams to encourage them to adopt best practice, but also to help inform the commissioners, be they PCTs or the new GP consortia, about what we feel the best quality of care should be and the most efficient care pathway should be, in order that they can commission those care pathways to encourage the best practice. I think institutions are looking much more closely at how they're perceived outside, at the quality of care they can deliver, be that high quality clinical care or just the way in which they treat and receive their patients. I think all of us have a duty to make sure that patients are received with the highest quality of courtesy. We make their lives easy. Too often, as a doctor, it's easy to do what we feel fits the organisation best. I think we have to be thinking more closely about actually what fits the patient best. The website does two things. It provides the clinical teams with information about what's happening, but more importantly, it provides patients with information about where care is delivered, and if they have more information about how where care is delivered, they can choose how they wish it to be delivered to them.